Good afternoon, and thanks for joining us again today. This briefing is being streamed live on YouTube, and the audio is available on Wisconsin Eye. Before opening remarks and your questions, a reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you are able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-Designee Andrea Palm, and available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestun, the Chief Legal Counsel for the Governor's Office. We will begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks for listening today. Last Friday, I called the legislature into special session to take up legislation that would allow all Wisconsinites to vote safely by mail. Earlier this morning, without the discussion or debate, they ended that session and took no action to ensure public health and safety. The situation in Wisconsin and in our nation has gotten worse since I first called that special session. The Federal Emergency Management Agency has granted Wisconsin a major disaster declaration for the entire state of Wisconsin as a result of the COVID-19 pandemic. Vice Admiral Jerome Adams, the United States Surgeon General, stated that the impact of COVID-19 will have on the United States this week is our, quote, Pearl Harbor moment, our 9/11 moment, and it's not going to be localized, it's going to be happening all over the country, unquote. Over the weekend, the president said about the upcoming week, quote, there will be a lot of death. Dr. Deborah Birx, the White House's coronavirus response coordinator, added that, quote, this is the moment not to be going into the grocery store, not going to the pharmacy, but by doing everything you can to keep your family and your friends safe, unquote. We're feeling that pain here in Wisconsin. Our friends and family are getting sick. Our healthcare systems are feeling strain, and frontline workers don't have all the resources they need to stay safe. We're seeing folks have to hold up signs and wave to their loved ones from across the street, and hearing heartbreaking stories about people suffering the devastation of this virus alone because it's too dangerous to have someone at their bedside. The number of deaths in Wisconsin continues to rise. On Friday, we had 56 confirmed COVID-19 deaths. By Sunday afternoon, we are up to 68 deaths, to include 2 deaths at a nursing home in Sheboygan, not far from where I grew up in Plymouth. The Wisconsin National Guard has been dispatched to establish a mobile testing site at the facility, the second time we've had to call up the National Guard to add support at a nursing home experiencing a cluster of COVID-19 cases and death. We expect more cases, we expect more deaths, we expect more tragedies. With that in mind, I cannot in good conscience allow any types of gathering that would further the spread of this disease and to put more lives at risk. I have been advised by public health experts at the Department of Health Services that despite the heroic efforts and good work of our local election officials, poll workers, and National Guard troops, there's not a sufficiently safe way to administer in-person voting tomorrow. That's why earlier today I signed Executive Order 74 to suspend in-person voting for the spring election until June 9th, and call on the legislature to convene in special session on April 7th to take up legislation extending the date of the spring election to June 9th, or another reasonable date we can all agree on. In the interim, eligible Wisconsin voters may continue to request, receive, and cast mail-in absentee ballots, register to vote or update their registration status, and all ballots already cast in the 2020 spring election will remain valid and will be canvassed in conjunction with the in-person voting on the new date. I've also said before that I am deeply concerned about the local elections on the ballot and ensuring continuity of government as we continue to respond to this crisis. Executive Order 74 will extend the terms of those currently serving in these local elected offices until we're able to safely hold an election and certify the results. Now, to be clear, this was not an easy decision that I made lightly. Frankly, there is no good answer to this problem. I wish it were easy. I have been asking everybody to do their part to help keep our families, our neighbors, and our communities safe, and I had hoped that the legislature would do its part, just as the rest of the state are, to help keep people healthy and safe. But as municipalities are consolidating polling locations and absent legislative or court action, I cannot in good conscience stand by and do nothing. The bottom line is that I have an obligation to keep people safe, and that's why I signed this executive order today. We've seen a number of other states, including our neighbors like Ohio, make changes in their elections in order to preserve public safety as we fight this disease. The difference between all those other states and what is happening in Wisconsin comes down to the legislature. In all those other states, Republicans and Democrats and the governor's office in the legislature work together to find the right solution. I've tried for weeks to meet Republicans in the middle to find common ground and figure out a Wisconsin solution. But at every turn, they fought all the way to the United States Supreme Court, even the most basic and common sense proposals to ensure a safe and fair election. That's not how it's supposed to work, folks. We've got to work together to keep people safe. That is the bottom line. All along, that has been my promise to Wisconsin. I will follow the science, I will listen to the public health experts, and every single decision I make will be guided by what the right thing is to do to protect public health and safety. There's no shame in changing course to keep people safe and, quite frankly, to save lives. Our allegiance cannot be to party or to ideology. It must be to the people of Wisconsin and their safety. You know, most Wisconsins don't care about political fighting or battles that are going on in the courts. They're just scared right now. They want a governor of the state to stand up for them, and so that's what I'm doing. The Wisconsin Constitution requires no less of me as governor. Our Constitution establishes that the purpose of the state of Wisconsin is to ensure domestic tranquility and promote the general welfare. And as governor, I made an oath to uphold that Constitution. My hope is that the courts of Wisconsin will agree that this is an unprecedented moment in time and affirm that my action today is necessary to keep the people of our state safe. And now I'll turn this over to Secretary Andre Palm.
Thank you, Governor. Good afternoon, everyone, and thanks so much for joining us again today. I want to thank the residents of Wisconsin. We know you are working so hard to follow the safer at home physical distancing guidelines to flatten the curve. Research coming out of the World Health Organization on COVID-19, as well as research on previous pandemics, all support strategies like safer at home and our physical distancing policies. The point of these policies is to buy more time in order to build our healthcare capacity, buy needed medical supplies, find more healthcare professionals, ensure adequate hospital bed and critical care capacity, increase our testing, and bulk up our contact tracing teams to get our state ready for the surge and beyond. The health and well-being of the residents of Wisconsin is our focus, and that is why we are taking further action today. The upcoming election is a statewide election, and it requires a statewide solution. In-person voting, by definition, inhibits our ability to physically distance, and the recent consolidation of polling locations in many parts of Wisconsin would result in mass gatherings. In-person voting would, without question, accelerate the transmission of COVID-19 and increase the number of cases. And an increase in the number of cases in Wisconsin would result in more deaths. Throughout this response, we have put the health and safety of Wisconsin residents first, and that is why I and the DHS public health experts advised Governor Evers to avoid the mass gatherings that would result from an in-person election on Tuesday. In addition, I have signed 2 emergency orders today regarding our healthcare system. The orders allow healthcare facilities, providers, and emergency medical services flexibility to address staffing needs so they are able to provide needed care. The order adjusts training and license renewal deadlines, as well as paramedic level ambulance staffing levels for emergency medical services. It suspends staff orientations at home health agencies and hospices, adjusts nurse aid training hours, relaxes criteria for resident care staff at community-based residential facilities and adult family homes, and ensures nursing homes cannot discharge patients who are unable to pay. The order also modifies requirements at opioid addiction treatment services so staff can continue to be responsive and accessible. Finally, they allow healthcare provider licenses that would have expired during the public health emergency to remain valid until 30 days after the emergency is over. In order to assist with this patient care, we'd like to give you an update on PPE, or personal protective equipment, that has come to us from the Federal Strategic National Stockpile. The total PPE Wisconsin has distributed from the Strategic National Stockpile includes 104,680 N95 respirators, 260,840 surgical masks, 48,168 face shields, and 140,750 pairs of gloves. This PPE will help protect our medical professionals as they do their important work of treating COVID-19 patients who need care. However, what we have received from the Strategic National Stockpile barely begins to meet the need or the requests of the Wisconsin healthcare system. In addition to the SNS, we continue to process PPE made available by the buyback and donation program that the governor launched last month. We have distributed supplies from these sources, including 15,100 N95 respirators, 24,200 surgical masks, and these have gone to public safety staff, including police and fire departments, to protect them as they do their essential work during this pandemic. We know this is a time of unprecedented stress for so many, and especially for our frontline healthcare workers. That is why our new website, resilient.wisconsin.gov, offers tools and resources to reduce stress during this pandemic. There are pages dedicated to helping first responders and healthcare workers, and there are also pages for the rest of us to learn more about mental health well-being and self-care, tools to reduce stress, and to stay connected in this time of physical distancing. These tools are so important because we know that safer at home is what we need to do to flatten the curve, and reducing our stress so it's possible to follow these guidelines is essential. I want to give an update now on our numbers for today. Here's where things stand. We've got 12 active labs running COVID tests in Wisconsin with a daily lab capacity of 3,563 tests. We have 26,574 negative tests, which is an increase of 1,405 over yesterday. We have 2 counties reporting cases for the first time, Kewaunee and Waushara, and there are now 2,440 positive tests, an increase of 173 positive COVID people here in the state of Wisconsin. Our number of COVID hospitalizations is 668, which is an increase of 44 over yesterday. And this means that 27% of people who have tested positive for COVID-19 in Wisconsin have been hospitalized. Our total deaths to date have now reached 77. The new deaths today include 1 death in Dane County, a male in his 90s, 6 additional deaths in Milwaukee County, a male in his 50s, 2 males in their 70s, and 1 female and 1 male in their 80s, as well as 1 male in his 90s. In Racine County, we have 1 male in his 70s that has passed away, as well as 1 male in his 60s in Winnebago County. Again, we honor the memories of those who have passed and grieve their loss, and grieve for those who are also experiencing this loss. When the numbers increase, it is easy to think of this pandemic in terms of graphs and the numbers on our web pages. But we need to remember that each number represents a person, a friend or family member, a neighbor, or a coworker. When we each do our part to flatten the curve through physical distancing and staying safer at home, we are doing our part to keep ourselves and others healthy and safe. And we are doing our part to give us time that we need to make sure our healthcare system and our frontline healthcare workers have the capacity and the tools they need to meet this challenge. Thank you for continuing to join us in that work.
Thank you, We'll now open it up to questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. For the sake of time, we also want to remind you that we are taking one question per reporter per outlet. We'll begin today with Scott Bauer from the Associated Press. Scott?
Thank you so much for taking the call. Governor, less than a week ago, you said that an order like this would be clearly against the law. Do you still believe that your order today is against the law, and if not, why not?
Certainly, circumstances have changed. We've seen a dramatic increase in the number of people that have been, the deaths have increased, as well as the number of people that are determined to be positive to COVID-19. In addition, we've had significant retraction as far as the number of polling places that are open. Clearly, anybody that can do basic math understands if you have fewer places to serve voters, that you will have larger numbers at those sites, numbers that will easily strain the system and frankly cause more positive results, or not positive results, negative results for the people that are there. So clearly, I believe that this falls under my ability to make sure that the security of the people of Wisconsin, which I do have obligations to maintain, is taken into account, and that's why I'm doing this today.
Thank you, Scott. And now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell? And a reminder, *6 to mute or unmute your phones. Mitchell Schmidt from the State Journal. Okay, we'll move on then to Patrick Marley from the Milwaukee Journal Sentinel. Patrick? Patrick Marley? Okay, moving on then to Melanie Conklin from the Wisconsin Examiner. Melanie.
Hello, Governor. Could you walk us through the decision you made on changing that changed your mind in terms of making this order today? Just a little bit more on the not just the timeline of the decision, but also your personal thoughts and the factors that get into it.
Yeah, and I'll go back in time a little bit. It's been several weeks now that it was clear that we needed to do something with this election. So we met with legislative leaders, talked through what are some possibilities, and couldn't come to any conclusion then. As time, and then we morphed into close to the present, but I did this, I required them to go into special session to resolve this problem, and it was responded with a gavel in and gavel out twice now within the last couple of days. The other piece, clearly, it was any time, and there were several judicial actions going on at the same time, and every time there was a decision, the Republicans rushed to the forefront and took several steps to make sure that those decisions were overcome. So clearly there was a issue of whether they wanted to make sure that people were safe or not. That said, at the end of the day, Melanie, to me it is, I was thinking about this all this weekend. The people of Wisconsin, the majority of them, don't spend all their waking hours thinking about are Republicans or Democrats getting the upper hand here, nor are they spending most of their time thinking about different court cases that go on ad nauseum. They're sitting there saying, I'm scared. I'm scared of going to the polls. I'm afraid of my future. At the end of the day, somebody's got to stand up for those folks. And I decided that it was important for the governor of the state, since I haven't had much luck, frankly, with the legislature, to take this step. It's an important step, but this transcends all that other stuff that the insiders, including me, frankly, I'm a politician as much as anybody else, but this isn't about politics. This isn't about judicial issues and fights. It's about the people of the state that are afraid of their future, afraid of their own personal safety. And my I believe that I have an obligation to stand up for them.
Thank you, Melanie. Now to Stephanie Hoff from WIS Politics. Stephanie? Stephanie Hoff?
Hi, my question is for Secretary Andrea Palm. You gave us numbers of how much PPE that you got from the national stockpile. Is there a goal that Wisconsin is trying to meet? You said that the stockpile didn't meet your request.
So Stephanie, the Federal Strategic National Stockpile is metered out to states based on your population size. And so we've gotten 2 of the 3 allocations that we will receive from the stockpile, as every other state will receive their proportional share. And so in addition to metering that out to local healthcare, long-term care, hospitals, et cetera, we have started this buyback and procurement program, and our goal is to supplement what we get from the Strategic National Stockpile to meet needs. But I think what we are seeing now and what we're seeing across the country is generally a shortage of needed protective equipment for our frontline and healthcare workers. And so our work is across a number of fronts, the Strategic National Stockpile, the buyback and donation program, and then just straight up procurement, which we have also exercised a number of contracts on and are awaiting delivery on things that we have purchased, again, to turn around and distribute to local communities across the state. We've also made all of these requests to FEMA so that we can continue to encourage our federal partners to help meet the needs that we have here in Wisconsin. But this is an all hands on deck, all options, pursuing all options at the same time to try to get what we need here in the state of Wisconsin. But there definitely are shortages nationwide of the various pieces of essential medical supplies that we need.
Thank you, Stephanie. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for taking my question. I had Secretary Palm, you mentioned that there are now 3,500 or so tests being done daily, or at least the capacity for that being done in the state. But there aren't as many tests being performed daily. I think about half of that. Why is there that gap, and are you looking at making any sort of changes so that we can potentially meet that capacity going forward?
Yeah, absolutely, Sean. I'll say a couple of things, and then I think Ryan can dig in on a few of the details here. So we have been prioritizing tests so that we're really focused on diagnosis and clinical care for those who are hospitalized, for our frontline healthcare workers, and for vulnerable populations like long-term care and the residents who live there. I think we've gotten, as you suggest, Sean, we've gotten into a groove in that space, and our capacity has started to expand, which is exactly what we wanted to do. It's exactly what our efforts and our public-private partnerships with a number of folks that we've announced over the last week or so were intended to do. And so for us, the next turn of the crank really is, as you suggest, how do we open the pipeline a little, recognizing that we're never going to be in a place where either asymptomatic people should be tested or where everyone needs to be tested, but what is the next targeted tranche of folks that help us increase the amount of testing to meet the capacity, and also how are we thinking about targeting that testing? For example, the governor in his remarks mentioned the Sheboygan nursing home. Do we do some targeted testing there just to wrap around that, make sure that we're really focused on the needs of that facility or others where you see little outbreaks like that? I think, right, that is something that we very much want to pursue, as well as other kinds of targeted testing strategies that push us to the limit of our capacity, but that really help us advance the public health and our knowledge of where we are with this outbreak. But I'll let Dr. Westergaard dig in a little bit.
Yeah, thanks. Good afternoon. This is Ryan Westergaard. I'd say the description was pretty good, that when we have ongoing conversations with clinicians in the field, both in hospitals and urgent care settings, it seems like the testing that's being done is about in accordance with the strategy that we had, which was to make sure that most people who have severe illnesses requiring hospitalizations and people for whom the stakes are really high to know, meaning they have comorbidities that make them likely to have severe illness, and the volume of tests really reflect the number of people who have met those criteria. So in the next phase, how do we make use of that capacity and really get public health value out of it? I think this one strategy is to be more deliberate about surveillance. So we don't need to test everyone with respiratory symptoms, but if we can strategically understand how many people who have mild symptoms in certain areas of the state are positive for COVID versus other things, we'll have a better sense of the speed and direction of the epidemic. So in the coming weeks and months, we want to really develop good strategies to sample people who don't have severe symptoms, but we can know whether they're infected. The other one, of course, is to be able to respond to outbreaks. And if there are areas where the epidemic is surging or going more quickly, we may need to have to test a large number of people. But right now, I would say that we're pleased on both fronts that we have capacity, and also that we haven't had a very large surge that would stress that capacity. So we're looking at ways to use these resources wisely in order to understand the epidemic and stay ahead of it as much as we can in the coming months.
Thank you, Sean. Now to Bob Haig from Wisconsin Radio Network. Bob? And a reminder, *6 to unmute your phone. Bob Haig from Wisconsin Radio Network. Okay, we'll move on then to Parker Shore from Wisconsin Watch. Parker?
Hi, thank you. This question is for the governor. I'm wondering whether there are any plans to increase or endorse compassionate releases, paroles, or commutations, or any other ways to further reduce the prison population beyond what has already happened.
Yeah, we're meeting regularly on that issue. I can't give you a specific answer, but it is an issue that our Department of Corrections is working on, as well as we had a meeting, unfortunately, with the Public Defender's Office the other day, but it's canceled, so we're rescheduling that, but we're actively looking at what avenues are available to us.
Thank you, Parker. Now to Brianna Riley from the Cap Times. Brianna? Brianna Riley? Okay, we'll move on then and try again for...
Sorry about that.
Go ahead.
Thanks so much for holding this call. Sorry about that. So Republican legislative leaders have already said that they will challenge the order. Governor, why not release this order later in the day to try to prevent a court challenge today?
Again, this is not, I'm not game playing here. The issue for me is the safety of the people of Wisconsin. That's my constitutional reasoning for doing it, and when I came to that conclusion, there was no question that I would release it as soon as possible.
Thank you, Brianna. Going back to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick? And a reminder, *6 to unmute your phone. Patrick Marley. Okay, we're going to have to move on then to Danny Maxwell from WKOW TV in Madison. Danny?
Hi, this is Emily in replacement of Danny.
Can you hear me now?
To echo... Oh.
One moment, Patrick. We'll
Hello?
get back to you. Right now, it's Emily Fanlin from WKOW. Emily?
Yeah, hi, Governor. Just to piggyback off that last question from Brianna, GOP leaders said they'll be challenging your executive order in the Wisconsin Supreme Court. With conservative justices holding a majority, are you concerned this election will still go on tomorrow? And if so, what's your message to those essentially risking their lives to work at the polls?
Well, first of all, I believe that the Supreme Court will be helpful. I mean, I understand the uniqueness of the situation, but at the end of the day, it's around safety. And as a constitutional officer, that is one of my roles is to make sure that safety is kept and the security of the people of Wisconsin is kept in a good place, that they'll rule with me. This again, I believe, spans conservative and liberal biases. So I'm not concerned about getting a fair hearing, and I think we can persevere. But if we fail, we will have failed many people in the state of Wisconsin, and I believe that we need to be successful in order to make sure that they're safe.
Thank you, Emily. Now to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick? Patrick Marley. One more time for Patrick Marley from the Journal-Sentinel. Patrick? Okay, we're moving on then to Taj Mahal from NBC 15 in Madison. Tajma?
Hi, are you able to hear me now?
Is this Patrick?
Hello?
Patrick?
Hello? There seems to be like a 30-second delay for anything I ask you.
Go ahead with your
Hello?
question then, please. Okay, Patrick, why don't you send your questions via email and we'll answer them that way because we have to move on, okay? To Taj Mahal from NBC 15. Tajma? Taj Mahal? Okay, moving on then to WORT Radio in Madison. WORT.
Hi, this is Charlie at WORT. I'm wondering, I have a question for Governor Evers. I'm wondering what guidance you have for local clerks and election officials who are still planning for this election.
Well, we're in a position where we believe that the election should be suspended until June 9th. They need to be under, that is our hope in order to remain safe. But of course, there's a possibility we could lose this case. I don't believe we will, but certainly for those clerks that may not have the same concern, I certainly appreciate it. I've talked to many of you, frankly, and I appreciate that good work, but that good work that you've done will serve you well on June 9th just as much as it would tomorrow.
Thank you, Shelley. Now to Amy Reed from News 3 in Madison. Amy?
Can you hear me okay?
Yes, we can.
Thank you. My question's for the governor. What communication did you have with legislative leaders this morning before issuing the order, I guess?
I called each and talked to each one of them, the legislative Republican leaders.
Thank you, Amy. To Robert from Madison 365. Robert?
Hi, good afternoon. Thank you. Hi, good afternoon. Thank you. This question for Secretary Palm or Dr. Westergaard. Talked about the number of tests that are available and the 12 active labs and things. Is there any consistent statewide guidance on who gets tested, or if we're looking at different county data about how many tests have been done, how many tests coming up positive? Try to compare those, you know what I mean?
Yeah, I can answer that question. So it's a topic that's changed twice, and it will likely change once more since the technology has expanded. On the guidance that we have that's been pushed out to clinicians right now is that consistent with national guidelines, clinicians should decide whether the patient really benefits from having a test done and knowing. And if that's the case, they can obtain a test at their discretion. There's no approval process or barriers that way. In the setting of limited test capacity at our 2 public health labs, we had issued criteria that were used to prioritize which tests get done with the most rapid turnaround time. And in those top 2 tiers were things like severe illness in the ICU, healthcare workers with symptoms, the people for whom we need to know rapidly. Clinicians are welcome to test anyone other that they think would benefit, but would have to send it to one of the other 12 labs other than the public health labs. So when that changes next, it'll be even more unregulated, if you will, meaning clinicians can use their judgment and test a wider number of people, including at the state lab, because capacity is getting wider. So we publish those guidance documents on our website. We post them to public health departments through an intranet that everyone has access to, and we communicate that directly with providers through our health alert network. And as that changes in the future with increased test capacity and other recommendations about how to wisely use tests, we'll continue to do it that way.
Thank you, Amy. Now to Nick Williams from the Milwaukee Business Journal. Nick? And a reminder, *6 to unmute your phones. Nick Williams from Milwaukee Business Journal. Okay, we'll move on then to Jeremy from Urban Milwaukee. Jeremy?
Question for the Secretary and for Dr. Westergaard. What does the testing supply look like long term right now? We heard a lot about it being fragile before. Are we out of the woods on that?
So we continue to watch that closely because the variety of ingredients for these tests are coming in and out of scarcity based on manufacturing capacity and when they're shipping and other things like that. But I think as you've heard Dr. Westergaard talk about, as the types of technology available to run these tests and therefore the kinds of ingredients that they use has expanded, we have worked hard to expand the kinds of technologies we're using so that we are less dependent on any single ingredient for all of our tests, for example. We have continued not only to expand the number of tests we can do, but of our of the available ingredients to do those tests. I think we still think that the supply chain is not secure, and so we're watching it very carefully. But we are not in a position today where we are worried about running out of an ingredient tomorrow or the day after. That would put us in a place where you would see a big drop in our daily testing capacity. I don't know if you want to say anything more about that.
I agree. We are not, I wouldn't say out of the woods because they're still subject to some limitations, but we're in a much better position than we were even a week ago. The workhorse of really our testing capacity is still that CDC developed assay that the state lab is using, which requires reagents that are being used all across the country. But the manufacturing of other tests that aren't dependent on those same pieces of equipment and reagents are scaling up rapidly. So it's looking good in the future, although still watching it closely.
Thank you, Jeremy. Now to Mark Stevens from CBS 58 Milwaukee. Mark?
Hi, this is Victor filling in for Mark for CBS. This question, I guess, is for both the governor and the secretary. With the date being pushed to June 9th, hypothetically speaking, there's still going to be in-person voting on that day, which will bring out many people during that time. What are the modeling? What do the models show us of what the situation with COVID-19 is going to look like in June, and how does that factor into the decision to push to that date?
Well, I'll just speak in general terms, Victor, and that is we push it out as far as we possibly could as it relates to making it meaningful, but also making it in a way that those poor incumbents that are in office, frankly against their will, have an opportunity to be relieved by those that have won the election. So just from a general speaking point of view, it was really important to make sure that we're getting past the point where we might be in a better place. As I said before, the virus, there's no guarantee on how the virus reacts, and so we might be back in this position on June 9th. But we felt it was at a reasonable place, and I don't know if there's any more science on that you can add.
I mean, I think the thing to remember about these models is that in many ways our job is to make them not true, right? And so their veracity beyond a couple, 3 weeks is not that great. And so we will need to continue to watch this very closely, just like we're watching it more broadly for the public health and safety. But I think, the models that are currently out there are suggesting that Wisconsin will peak at sometime between 3 and 7 weeks. And so obviously it is our goal to flatten the curve, to push that peak out as far as we can so that we are doing the work that needs to be done in the interim in these priority areas, these strike teams that we keep talking about, to enhance our capacity, make sure we have enough healthcare workers, that we're doing all we need to do in testing, that our contact tracing teams are really robust, because until there's a vaccine or treatment, we're going to need to very, very actively manage this for a long time. And so we need to get to that steady state where we're able to do that. This is going to continue to be an ongoing, day by day, look at the data, make sure you're calibrating and moving forward to protect our healthcare system and the people of Wisconsin.
Thank you, Mark. Now to Mark Krieger from Fox 6 in Milwaukee. Mark? Fox 6?
Hi,
Go ahead.
this is Jason from Fox 6.
Go ahead.
Governor Evers, what's your legal argument that you haven't broken the law when last week you said if I could have changed the election on my own, I would have, but I can't without violating state law?
Sure, I think I can answer that question for the governor. This is Brian Elsestuen. The governor has both broad constitutional executive power and then also emergency powers, and this laid out in detail in the executive order on what the basis is for this. But as the governor said earlier, the facts on the ground have changed from a week ago, and his authority and responsibility to protect personal security, that changes depending on the facts on the ground, where we're seeing the numbers increasing. We're seeing rapid consolidation of the number of polling places, which is going to increase the number of people congregating at each of those few polling stations. Especially, we've seen that in Milwaukee. We saw that in Waukesha, going down to a single polling location. Same thing with Green Bay and other municipalities. So, the facts on the ground support that, this is a unique situation. This is an unprecedented situation in our state's history, and thus it's not even really a choice, but a need in order to protect personal security to not allow in-person voting tomorrow.
Thank you, Mark. Now to Marty from TMJ4 in Milwaukee. Marty?
Hi there, can you hear me?
Yes, we can.
So my question is for the governor. When do you intend to hear from the Supreme Court on this issue, and can you give us an idea of what the process looks like from that standpoint? Thank you.
I think I'll probably answer that question as well. I would expect that we would probably hear something today from the Supreme Court in terms of, whether or not they'll take up any challenge. We haven't seen a complaint from Speaker Voss or Majority Leader Fitzgerald yet. They said they were going to go straight to the Supreme Court. I think when we've been discussing this, I think it is important, as the governor said, that the Supreme Court does hear a matter like this, where this whole situation requires cooperation and work among the three branches of government. And the governor has called on the legislature repeatedly to address this issue, and they've refused to do so. Instead, they've decided just to litigate things endlessly. And thus, this extraordinary action in order to protect people was done. And the Supreme Court can add certainty and finality to that decision. And so whether it's today or tomorrow or not at all, all three branches have a very important role to play in this.
Thank you, Marty. Now to Andy from WISN TV in Milwaukee. Andy?
Hi, Governor. It's Matt Smith from WISN Channel 12. Wondering if the Supreme Court does agree with Republicans on this, are you or the Secretary prepared to take any further action? And to that, are you advising municipalities to issue their own orders to stop voting tomorrow? It seems like we've seen a number of those, put those out within the past hour.
Yeah, we're not advising the municipalities to do anything. That's their role in life. If the Supreme Court rules against us, then I'm making this case on public health status, so this is it. We're counting on the Supreme Court to support us. We believe it's important for the safety and security of the people of Wisconsin to do this, and we're making our best case possible.
Thank you, Andy. Now to Mark Leland from Fox 11 in Green Bay. Mark? Fox 11.
Thank you. Just following up on that, I know back in Ohio last month, when the governor's efforts failed, the health secretary issued his own emergency health order. Is that something that we could do? You could do here, having Secretary Palm issue the emergency order, essentially closing the polls, and what other legal options?
Yeah, this is it. The governor of the state of Wisconsin is responsible for this decision, and this will be the last decision. This will be the last avenue that we're taking. Yes, indeed, Secretary Palm gave me information that led me to this decision. I think it's important for this case that the governor of the state of Wisconsin took this on and advocated for the people of the state of Wisconsin, their health, their security. This is it. There's not a plan B. There's not a plan C. We're moving ahead with this. We believe the Supreme Court will support us in this.
Thank you, Mark. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey?
My question is more related to the percentages. I mean, 2,400 people testing positive in the state, percentage-wise, isn't huge on paper. So what's really kind of the current state of threat here in Wisconsin when it comes to those types of numbers?
So I'll let Dr. Westergaard pile on here, but so I think, right, we've been testing a prioritized group of folks based on healthcare providers' discretion and request for that test. And so what we know is that there are a lot of folks with mild symptoms who have spoken to their healthcare providers and been advised to stay home and recover at home so that we're not exposing people in the healthcare system and in the community to their potential infection. And so we know that the total number of positive cases is less than what the actual outbreak is here in the state of Wisconsin. And so I think Dr. Westergaard could speak a little bit more about what our experiences in other states and across the globe tell us about the percentage of positives to the infection rate.
Yeah, it's a challenge we're trying to balance, as the Secretary said, with the safest thing for individuals with mild symptoms is to stay at home. And during the safer at home order, that's really a blanket recommendation for most of the population. So we want people to be able to be evaluated and make sure that they know where to turn if they feel unwell and need an evaluation. But many people with symptoms that could in reality be COVID-19 aren't being tested. So how high is that percentage? Well, from other areas of the country, it might be as high as 80-85%. In the largest series that was published using a larger population in China, they estimated about 86% were undiagnosed, meaning those are the people that didn't come into the hospital to get tested. So we don't know if it's that high. Our goal right now during this last month, where we're encouraging everyone to stay at home, is to identify and isolate people who have symptoms, who might expose people in healthcare settings, and for everyone else who has mild symptoms to do infection control in their homes. So down the road, I think we'll have a sense, there's more tests that can be done on a population level to understand how many people have been exposed. And last week we talked about the antibody tests coming online. So we really need to study what after this initial wave, what proportion of people truly have been infected, and then we'll find out. But right now our guess is that we're testing a tip of an iceberg that might be 10 to 20% of the most sick people. So whether you take the number of documented cases times 5 or times 10, it might be in that ballpark. But the important thing, I think, is that the individuals who are most sick are getting diagnosed, and we need to do that to prevent people from transmitting the virus in healthcare settings and long-term care settings. So that's how we've been prioritizing it, and really some window into what we still need to learn about on the rest of the population.
Thank you, Casey. Now to Addie Bink from WFRV in Green Bay. Addie?
Hi, yeah, thank you again
taking this call. I was just wondering if there's been any thought in sort of updating the safer at home order. We've seen a lot of boat launches, piers, and such closing because there are a ton of fishermen actually going out, standing really close together and fishing. So I was just wondering if there's been any consideration of updating the safer at home order.
Question. So this is Ryan Nelson. It's, we continuously get feedback both from local municipalities, but then also, a lot of businesses, both large and small, and it's something we're taking a close look at on how we can improve safer at home. One of the other things too is we're keeping a very close eye at what the numbers on the ground are, and areas where we do need to have improvements, whether that's tightening up some areas or adjusting restrictions in other areas, is something that we're taking a very close look at.
Thank you, Addie. Now to WBAY in Green Bay. WBAY?
Hi there, this is Cammie Rapson from WBAY in Green Bay. A question for the governor. What message do you have for the people of Wisconsin who are watching this unfold over the last several days and weeks and wondering why this has to end up in court not once but potentially twice?
I would wonder that too, frankly. And that's one of the reasons I did what I did today. We've been working on this for several weeks to address how this election will look, and we haven't been able to solve it politically. The most recent example is the inability of the legislature, the Republican leaders, to even take a vote on something, to even have a conversation about something during special session. So I'll go back to my original statement I made several minutes ago, and that is, I know the majority of the people of the state of Wisconsin don't follow the yings and yangs and up and down of the political world here, and we have plenty of them. But a lot of people don't even pay attention to a lot of that. They've got other things to worry about, such as their health. The other thing that I know is that people are afraid, and the people on the ground are telling us that. So my message is this: do I believe that that we're going to win this case with the Supreme Court? Yes. If we don't, we have to make sure that those polling places are as safe as possible. But frankly, I don't know how 5 polling places in the city of Milwaukee can be safe. And that's why I'm doing what I'm doing.
Thank you, Cammie. Now to John Neiser from NBC 26 in Green Bay. John?
Abigail sitting in for John. My question kind of goes back to the safer at home order. While for many people it may seem like this has lasted a very long time, in reality we're only about 2.5 weeks out for when this is supposed to end. So my question is, are there plans in the works, are there possibilities this could get extended?
Well, we're looking at all options, and that includes making sure that we have the data in hand to make that determination. So is it possible to extend it? Yes. Is it possible to maybe look at it a little differently? We're always looking for that, but we base those decisions on science, and we will continue to do so.
Now to Courtney from WAOW in Wausau. Courtney?
Hi. Hi, thank you so much for taking this call. You know, we've talked a lot about the April election, but here in Wausau, we also have the May 12th special election for the 7th district. Is there any thought right now on also postponing that?
As we move forward, we'll of course be looking at the data and the science to make that decision. We have not made a decision on that.
Thank you, Courtney. Now to WCLO Radio. WCLO?
Hi, yeah. I was curious if the state has a direction that they've given to the county, or to counties across the state when it comes to HIPAA and the privacy of patients who have tested positive for coronavirus. I know locally here in Rock County, we've had some discrepancy between municipality leaders and local leaders and even first responders not having as much access to information about where patients may be located for their safety and for their planning. And the county has referenced citing state legal guidance that, public health information like that should be protected even from other local leaders and first responders. So I was curious if the state has issued any guidance or what the state's position is on HIPAA and what should be given to the public versus local leaders and first responders.
So I think, right, our posture on this from the very outset has been that protecting the privacy of those infected by COVID-19 is a really important thing to preserve, and that the information we have been providing publicly is focused on information that is necessary to advance the public health. And so that is a paramount principle for us, but we also recognize that in a world where we have a shortage of PPE and where our first responders are sometimes going to be in contact with somebody who is infected with COVID-19, that information can help protect them as they do their jobs on a daily basis. And so we have issued guidance that would provide that information to those first responders only for use in a call, a visit, whatever, a response, that's the right word, to a home where somebody is infected with COVID-19. Again, I think our first responders need to be thinking that anybody they come in contact could be infected, and they need to take those universal precautions to be as safe as they can while they're doing their jobs. But again, recognizing that there is a shortage of PPE, and while we have started to distribute PPE to them, we know that it's not enough, and so it seemed like the right balance there was to provide them additional access to that information, recognizing that we need them to protect the privacy of it, but that using it in carrying out their day-to-day jobs could be helpful to them in protecting their own health and safety.
Okay, thank you. Now to Ben Meyer from WXPR Public Radio in Rhinelander. Ben?
Good afternoon. This question is for Secretary-designate Palm and perhaps Dr. Westergaard. Our part of the state here in northern Wisconsin is one of the only parts of the state that has some counties that still have no positive confirmed cases of COVID-19. My question is, if and when they do get cases, they'll obviously get cases later than many other cases or counties in the rest of the state. Should we anticipate that the outbreak in these counties, because it started later, might also end later, might last longer?
It's a good question.
Yeah, I would say that's possible, but it's subject to the the caution I said before is that when we're testing a small tip of the iceberg of the possible cases, of the likely true cases, it's possible that there's already community spread in most areas of the state. So just because we haven't detected individuals who have tested positive, there may be people who have not come to medical attention that have already been infected. So the epidemic curve might already be underway in all areas of the state. Of course, we don't know that for sure. So I think the biggest driver when you look globally about where places have the epidemic has hit first and hardest have been densely populated areas. In our region, Chicago seems to be a week or two ahead of us in terms of the acceleration of the epidemic. Of course, New York City has really been the epicenter in the U.S. So that does mean that it might come to places that are less densely populated later. But I would say the thing that we also have going in our favor is that a smaller population also gives us more opportunities to contain and prevent onward spread. So when we're talking with single-digit numbers of cases, it really gives us an opportunity to do the contact interviews and get around local outbreaks and shut them down. So I think our optimism would be that in areas that don't have a high number of cases, they're not going to follow the same trajectory of a large peak because we'll have the capacity to respond and contain the outbreaks in local communities better, which we're trying to build and strengthen and make more efficient all the time. So I would say the short answer is not necessarily, and we're going to do everything that we can to prevent longer and more sustained outbreaks in all Wisconsin communities.
Thank you, Ben. Now to Matt Piper from the Sheboygan Press. Matt?
Yeah, thank you. I'm wondering about the 12 active labs that you referenced earlier doing the almost 3,600 tests a day now, or at least having that kind of capacity. If I remember right, at one point there were 40-some labs that might be capable of doing these tests. Correct me if I'm wrong on that, but I'm just wondering why is that number only 12? Is there something that's holding labs back? And if so, what is that?
Yeah, I think I can clarify the previous comment about the 40 number. So I think I had mentioned in our earlier briefing that we have received test results from 40 different labs. Some of those are national labs that are reference labs that people can send to in other states. And there's a large network of national labs where I think the 12 are Wisconsin labs. Is that correct?
But to your broader question, right, the sophistication that's required of a lab to do this test is a thing, right? It's a rate limiting factor. But as Dr. Westergaard has talked about previously, as more technologies come on board, as FDA approves more opportunities for testing, and those things are less sophisticated, less complicated to run, there will be more places in the state of Wisconsin that can do those tests. I think Dr. Westergaard talked about the cartridges that are starting to be manufactured, and so we do in the next month to 2 months expect some of those technologies to be more available in the marketplace, and that there are more places in the state of Wisconsin which have the kind of equipment that you need to do these less sophisticated tests that are starting to come into the marketplace now.
Thank you, Matt. Now to Courtney Garish from Spectrum News 1. Courtney? Spectrum News?
Hello.
Question.
Hello, can you hear me?
Yes, we can.
Hello. Okay, thank you. Sorry about that. It's Courtney Garish from Spectrum News. I had a question on, maybe Dr. Westergaard can handle this one. Last week you said you were encouraged as we start to come into the curve about the lower numbers, that we've been holding steady on the number of cases. Has that changed your projections for need for a surge, like the number of ventilators, and also what is the peak date? Do we have one? I saw a model that said it could be as early as next week, April 17th.
Sure. When we spoke last week, I mentioned that some of our early modeling that we did internally using our early data in March suggested that the doubling time, meaning how long it takes for the number of cases that are either diagnosed or the total number of cases to double, that's a useful metric. The shorter the doubling time, the faster the epidemic is accelerating. And the initial projections were that was about, they used an estimate of 3.4 days of a doubling time. Late last week, when we looked sort of the updated data, it looked like it was about 4, which was what we said was encouraging. When we just looked at the numbers today, as more data have gone by, it may be as high as 7. So that's what flattening the curve actually looks like. You know, we know that in a population, we know what this virus can do in a population where people are interacting in the normal way. It can double as fast as every 2 days. That's what happened in the early part of the epidemic in China. That's what happened in the explosive outbreaks in Italy and New York City. So the fact that we're progressing at the pace that we are is encouraging that we've made positive impact and that it's growing less quickly than we had. So what does that mean for the peak and what we expect the peak? That story's still being written. The modeling data that the University of Washington is doing is still saying around May, but I think I'd echo what the Secretary said earlier, that if the estimated peak is May 1st, for example, that doesn't predict, that doesn't tell us that that's what's going to happen. That's sort of a best guess with a certain set of assumptions based on how things have gone in the past and how we expect things to behave. If we loosen up, if we allow more person-to-person contact. If we stop doing safer at home, we're going to do a lot worse than that. There's going to be a higher peak. If we really double down and continue what we're doing, we may not have a peak that is at high. So that the timing, that when the peak happens and how high the peak is really something that's under a lot of our control. And it's really one of the messages that we want the public to understand, is that the projections are our best guesses based on computer models that take in a lot of different information about the way things have gone elsewhere. But what the actual curve is depends on how well we do what we're trying to do here, which is prevent the spread of infections through staying at home and hand hygiene and all the other things that we talk about. So we don't know exactly when, but we want the peak to be as low as we can, and that's what we're certain of.
Thank you, Courtney. Now to Jonathan from Up North News. Jonathan? And a reminder, *6 to unmute your phones. Jonathan Sadowski from Up North News. Okay, and our final question today comes from Casey Cherry from PBS Frontline. Casey? And a reminder, *6 to unmute your phones. Casey Cherry. Okay, well, with that, we'll conclude today's media briefing. Please continue to monitor the DHS COVID-19 webpage, as well as the Outbreaks and Investigations page for data and guidance materials. For answers to questions concerning the COVID-19 response that are not related to public health, please visit the websites of the Governor, the Wisconsin Economic Development Corporation, the Department of Workforce Development, and Wisconsin Emergency Management. Thank you, and have a good and safe afternoon.